Welcome to 41 Today Lifestyle, everyone. I'm Troy Thompson. As you may have seen, all the pink ribbons all over the place when it comes to newspapers and TV, radio. Why? It is Breast Cancer Awareness Month. We wanted to dig a little bit deeper and find out what is going on behind the scenes. So, of course, we invited in one of our experts, Dr. Cheryl Jones from Georgia Cancer Specialist. Welcome to the show, my friend.
Thank you.
Okay, I want to ask you a very serious question. Is breast cancer on the increase?
There is an increase worldwide of breast cancer, and most importantly, breast cancer survivors. In the United States, there are now 3.9 million women who've been diagnosed and been treated with breast cancer.
Why is there an increase?
Well, there are a lot of lifestyle changes. We have early diagnoses and risk factors that we've identified. We also have women that have been diagnosed with one or even a second breast cancer many years later.
Well, I have been told, I've been doing these type of interviews for many years, and I have been told it is very much a hereditary condition, correct?
Genetics plays an important part in breast cancer. The science that we've learned in the last 10 years about genetics has led us to new diagnostic recommendations for men and women with breast cancer and for family history treatments for patients with breast cancer. Well,
you may have heard Doctor just then say men as well. It's something that I do want to have a conversation about if you wouldn't mind. Dr. Jones, let's discuss the male physique when it comes to breast cancer. A great friend of mine lost over 100 pounds, lost all the weight and then discovered he had breast cancer.
Oh, goodness.
Just from losing the weight in self-examination. Let's talk about that, can we?
Well, breast cancer or cancer anywhere in the body begins with a change in the cell. So men have breast cells just like women, although they have a smaller volume. Now, when cancer develops and there's a change in the growth of those cells, that's when it becomes cancerous. Typically, when a man has breast cancer, there's a strong family history of breast cancer in the women as well. And that's a strong risk factor in a family that needs genetic testing.
Okay, interesting you just said that for the breast cancer genetically. If your father had been diagnosed with breast cancer and you're a male as his son, is there a way that you will be subjected to that as well? Just like maybe your sister or mother?
Right. So the genetics are inherited. You inherited half of your genes from your father and half from your mother. So every child that father would have had would have a 50% chance of inheriting a gene for breast cancer, male and female.
How do men self-examine?
They self-examine just like women. It's recommended in the high-risk individuals that once a month they would examine their bodies and be aware of their bodies. Men don't routinely get mammograms like women do.
No. Very quickly, let's talk very briefly about the triple-negative breast cancer. What is it?
So triple-negative breast cancer is a special type of breast cancer. There are three main types: hormone-sensitive, HER2-amplified, and they have targeted treatments. Triple-negative does not have a treatment other than chemotherapy, and it affects mainly younger women, African Americans, and those individuals with genetic abnormalities.
Briefly, what age should we be doing self-examination and what age can we be doing mammograms?
So it's recommended that for the average risk individual, mammograms begin at age 40. For higher risk, however, they need to talk with their physician for a more intense screening program.
And I think that's super important. Be open with your mother, or mothers be open with your daughters as well, and talk them through it, or come and see someone like you.
Exactly.
We appreciate you coming in. Thank you so much for giving us great information. If you want to find out more information about Breast Cancer Awareness Month, there it all is up on the screen. Of course, Georgia Cancer Specialist, they have a great team over there. Go over and help them talk you through that next step. Back after this short break.